he had his theory, and he didn't have any way of proving it because, I mean, how do you prove something like that? Until this family showed up at his doorstep, and it was a Canadian family from Winnipeg, I think, right?
I think that's right. Yeah.
Yeah. And they were the Reamer family, a blue-collar, very young couple, 20, 21 years old. And they had a horrific tragedy in their family, which is that they gave birth to twin boys. The boys were fine. And when the boys were, well, actually, they had phimosis. Phimosis is a abnormality of the opening of the urethra. And so the doctors recommended circumcision for the boys. And they went in when they were 8 months old for circumcision. And the first boy to go in for the circumcision was Bruce. And the equipment, there was a malfunction of the equipment. And they were cauterizing the penis in order to circumcise it. And instead of just that small amount of tissue that was supposed to be cauterized, apparently the settings were incorrect, and the entire penis was burnt. So Bruce's penis was burnt, beyond any functionality. So these poor parents went home. The other boy was not circumcised, just obviously. They went home, and what are they supposed to do? They have a boy without a penis. What the hell are they supposed to do? So months later, they were watching television, and John Money happened to be on there. And you have to know also that John Money was an extremely pompous, self-assured individual. He was sophisticated. When he talked, you listened. He came across as being definitive, being, calling the shots, knowing what was going on, knowing the research, knowing the truth. And he, in this interview on television, said that a boy can be raised as a girl and a girl can be raised as a boy if it's done early enough. And that early enough means before the age of 2.5 or 3. And the parents, the Reamer parents, immediately took note of that, and they thought, here's the answer. This is the answer for Bruce. This is what we're supposed to do. So they contacted Dr. Money down in Baltimore, and they made an appointment and took the twins down to Baltimore and went down there. Again, you have to understand that this was a uneducated, young, blue-collar family. And when they were interviewed later about their meetings with John Money, they described him as like, we just thought he was God. Mm-hmm. We just thought, he's a professor, and he's, got all the diplomas, and he's the head of this entire
new
clinic. At an outstanding university, one of the major universities in the world.
That was at Johns Hopkins, right?
Yes,
yeah, right.
Yes. So you have to imagine this young couple coming, and they're at a loss, and they are looking for an answer. They've been praying, they're looking for an answer to their prayers. What are we going to do with Bruce? And John Money says, well, we have an answer for you. Because male and female is actually not related to chromosomes. It's not related to hormones. It's not innate. We can take little Bruce, and we have to do some surgery on Bruce. We have to castrate him, and we'll remove his testicles, He already didn't have a penis. We're going to remove his testicles. We're going to fashion, some sort of elementary sort of female genitalia. You're going to give him a girl's name, and you're going to put him in pink dresses and give him dolls and raise him as a girl. And you are never, ever, Dr. Money told the parents, never to tell him that this was truly what happened and after he was born. Never tell him, because that will ruin everything. And it's up to you. You have to just work your hardest to raise him as a girl and make sure that everyone around him is considering him a girl, because essentially he is a girl. And so not only was this the answer to the Reamers' prayers, this was, as you can understand now, the answer to Dr. Money's prayers.
Right. He had an experiment.
This was the experiment. This was his proof of concept. His concept was that being male and female is completely separate from biology. It's imposed by society. It's a social construct. And this was his proof of concept. And so the Reamers went home. Well, he had his surgery. They took him home. They named Bruce Brenda. They put him in all the girls' clothing, and they gave him dolls, and they did all the things. And he peed sitting down sometimes, because as we'll learn later, he actually preferred urinating standing up, which is astonishing. We learned later that he always wanted to urinate standing up. And from the time he was in diapers, I think, he was told he was a girl. So that really is fascinating. But anyway, so they took him home, raised him as a girl, and Dr. Money started to follow the twins. Every year, they would come down for a visit. The parents would spend time speaking to Dr. Money, and then the money, there's a slip.
Freudian slip for you.
Yeah. Dr. Money would take the twins without the parents into his office and spend time with the twins. So this went on for years. And Dr. Money began to report on his study that became a famous landmark study. And he called her Joan in his study. He was beginning to write about this and lecture. And he was claiming that Joan, AKA Brenda, AKA Bruce, was doing great. She was adjusting. She may be a bit of a tomboy. He would acknowledge that. But in every way, she was adjusting, and she was doing well with friends and with schools, and she liked playing with dolls, and she would mimic her mom. And he was giving this glowing report from year to year, and in his professional writing of his studies, his report, and he was giving talks, and he was getting, you might imagine, tremendous attention for this. You have to understand, this was by now maybe, the early 60s. This is feminism, okay? This is the sexual revolution. This is a time when society, or at least part of society, wanted nothing more to say that male and female is a social construct. And that in order to gain, full equality, women have to be considered the same as men. And, to have a study such as this study of John Money's, in which he was reporting that this baby who was XY, normal chromosomes, normal everything biologically, but is being successfully raised as a girl because he has a girl's name and girls and dresses and dolls and all, his entire society, his teachers and his grandparents and everyone is reinforcing the idea that he's a delicate girl who likes to cook and, is going to grow up to have babies. I mean, this was huge.